reproductive hormones and vitamins, anterior pituitary gonadotropins. What is gonadotropins? Both luteinizing hormone and follicle-stimulating hormone are glycoprotein hormones. They are secreted from the gonadotrope cells of the anterior pituitary gland. They consist of two polypeptide subunits. The pituitary hormones, follicle-stimulating hormone, and luteinizing hormone, as well as related hormones, human chorionic gonadotropins or HCG, and equine chorionic gonadotropin or ECG, or pregnant mare serum gonadotropin (PMSG), are referred to as the gonadotropic hormones. Each hormone is a glycosylated heterodimer containing a common alpha subunit and a distinct beta subunit that confers specificity of action. A single hypothalamic releasing factor, GnRH, controls the synthesis and release of pituitary gonadotropins. Luteinizing hormone and follicle-stimulating hormone in males and females. Luteinizing hormone and follicle-stimulating hormone are synthesized and secreted by gonadotropes, which make up 20% of anterior pituitary cells. Gonadosteroid hormones, androgen, estrogens, and progesterone cause feedback inhibition at the level of the pituitary and the hypothalamus to decrease pituitary gonadotropin secretion. The pre-ovulatory surge of estrogen also can exert stimulatory effect on the hypothalamus and thus promote pituitary gonadotropin surge release. HCG is produced only in primates and is synthesized by syncytio trypophoblas cells of the placenta. ECG is produced only in equids and is secreted from the endometrial cups of pregnant mares in early pregnancy. In males, luteinizing hormone acts on testicular Leydig cells to stimulate the synthesis of androgens, primarily testosterone. Follicle-stimulating hormone acts on the Sertoli cells to stimulate the production of proteins and nutrients required for the regulation of sperm production and maturation. In females, FSH and LH stimulate the growth and development of ovarian follicles and thereby stimulate the follicle to produce estrogen, while luteinizing hormone induces ovulation and stimulates the developing corpus luteum. After ovulation, secrete progesterone. Effects. The gonadotropic hormones control the estrous cycle of the female and modulate testicular functions in the male. In the female, the follicle-stimulating hormone is responsible mainly for growth of the follicle by binding to granulosa cells and stimulating estradiol production. Luteinizing hormone is responsible for final maturation and ovulation by binding to the thecal cells of the developing follicle and stimulating the synthesis of androgens. In the male, luteinizing hormone binds to the Leydig cells or interstitial cells located in the connective tissue stroma of the testis and stimulate androgen production. The gonadotropins are available as a powder, which can be easily reconstituted by the addition of sterile water, saline, or appropriate buffer. Once in the liquid form, they must be stored at 4 degrees centigrade and not subjected to excessive agitation to prevent denaturation of protein. Therapeutic uses. Apart from diagnostic application and pregnancy detection kits, an example, HCG in early pregnancy tests for humans, gonadotropins are used in 1. Promoting female and male fertility, and 2. Treating cryptorchidism. The gonadotropin preparations that are available and commonly used clinically in animals are human chorionic gonadotropin, also known as HCG, equine chorionic gonadotropin, ECG, and follicle-stimulating hormone, folitropin V. Human chorionic gonadotropin or HCG. HCG is a gonadal-stimulating hormone obtained from the urine of pregnant women. It is synthesized by syncytio trypophoblas cells of the placenta. It mainly possesses LH-like activity. Therefore, it serves as a substitute for luteinizing hormone to promote follicle maturation, ovulation, and formation of corpus luteum. HCG is a glycoprotein and non-pituitary gonadotropin with long-lasting biological effects that is greater than 24 hours. A single injection is adequate for most reproductive uses. For example, because of its predominant luteinizing-like activity, HCG is used after an appropriate follicular size has been achieved. Uses of HCG. HCG is widely used for infertility therapy. It is used in female horses for hypogonadism due to the pituitary hypofunction and to hasten or induce ovulation. HCG is used for the treatment of cystic ovaries in cows by luteinizing the cystic structures to form a corpus luteum. The corpus luteum either regresses naturally or can be induced to regress with prostaglandin F2A analogs. Treatment recommendations are either HCG 5,000 IU IV or 10,000 IU IM. Most cows respond with the establishment of an estrous cycle within 3 to 4 weeks. ECG 400 IU and HCG 200 IU together make up PG600R. PG600, which is used in pigs to promote follicle development and induce estrous cycles in prepubertal gilts. HCG is useful for treating male infertility due to impotence, particularly in stallion. In the male, HCG stimulates the interstitial cells to produce testosterone. HCG has been used for the correction of cryptorchidism in dogs. This practice has a low success rate in boys with congenital cryptorchidism and is considered controversial in all species. HCG may be used in sequence with ECG for the induction of pseudo-pregnancy in cats and fertile estrus in dogs. Adverse reactions and side effects. Immunological reactions such as hives and anaphylaxis due to anti-hormone antibody production have been reported. Prolonged usage may produce loss of efficacy, which is not reliably correlated with circulating antibody titers in horses. Use has been associated with prolonged and permanent infertility in cats. Equine chorionic gonadotropin or ECG. ECG, formerly known as pregnant mare serum gonadotropin or PMSG, is secreted from the endometrial cups of pregnant mares in early pregnancy in order to induce secondary and accessory corporal lutea by developing and ovulating additional follicles and to maintain the primary corpus luteum and thus progesterone secretion in the mare. Its gonadotropic activity is primarily follicle stimulating like in the horse and increases ovarian follicular growth, but it has sufficient luteinizing hormone-like activity to induce ovulation or luteinization. Like HCG, ECG is a glycoprotein and non-pituitary gonadotropins with long-lasting biological effects greater than 24 hours. A single injection is generally sufficient for marked growth of ovarian follicles. Uses of ECG. ECG is frequently used to stimulate ovarian follicular growth in the anestrus sheep or goat. It is used in combination with HCG for induction of ovulation and corpus luteum formation. ECG 400 IU and HCG 200 IU together make up PG600, which is used in pigs for inducing follicular growth and estrous cycles in prepubertal gilts. ECG followed by HCG have been used successfully to induce fertile estrus in dogs. Dosage. ECG has PG600, which is a combination of 400 IU international unit ECG and 200 international unit HCG. 1 ml can be induced in pigs via intramuscular. HCG has folitine and crorulon. Injection 5,000 unit and 10,000 unit. In dogs, 50 to 100 microgram can be induced via subcutaneous and intravenous. In cats, 25 microgram can be induced via intramuscular. In horses, 1,000 to 2,500 units can be induced via intravenous. In sheep, 400 to 800 units can be induced via intravenous and intramuscular. In goat, 3,000 units can be induced via intravenous.